PRP stands for platelet-rich plasma. So platelet, it's the platelet-rich part that we give from your blood. We obtain that through drawing some blood, spinning down the blood in a centrifugation process, which leads to a concentration of platelets above what you would expect, or above what is normally present in just your blood alone. PRP can be used to treat a lot of different things. One of the common uses for PRP is using it to treat arthritis or joint-related problems such as chronic tendonitis or even acute tendonitis, or in some cases we might even treat an acute ankle sprain, which can speed up the healing of it. It's used a lot in sports medicine, sometimes even at the professional level to get athletes back on the field faster. And there's several examples of athletes that have obtained PRP for treatment of torn tendons, etc. The risks are really minimal because you're using your own blood, so we're not using really any drugs. We may use a little bit of local anesthetic to anesthetize the tissue, but and we don't use really any other drugs at all. And so the risks would be anything associated with the standard injection, such as possibly infection, which is a low risk because the PRP actually has a lot of anti-infective properties and it has its immune cells. So anything like you could put the needle in the wrong place, puncture a blood vessel, cause a hematoma, nerve injury, that would be the main risks like you receive with any injection. I think anybody that has any chronic pain issues involving the musculoskeletal system, for sure. So people with chronic neck pain, cervical pain with chronic myalgias, muscle aches in that area, back pain, hip pain such as bursitis, greater trochanteric bursitis, which is a patient I just treated for that, which can be helpful anywhere you would use corticosteroids, but you don't have you actually get healing with this as opposed to corticosteroids, which mainly just block inflammation and can actually lead to more damage in some cases. PRP is basically just, as you would normally go to see the physician to consult about any ailment, and if it's a musculoskeletal ailment, that's one of the main uses of it. Then the patient could consult and then arrange for treatment. And it's a short duration treatment. It takes about an hour with spinning down the blood and injecting the area. The procedure basically just is first establishing that the patient is a good candidate, that they have a problem that I think will be helped by platelet-rich plasma. And then the patient comes to the clinic, they have their blood drawn, just like you would get your bloods drawn for a lab. And then we take the blood and we put it in it's in a syringe usually when you draw it, and that actually acts as the kit that we use to spin the blood down in. So it's a closed system the whole way through the system I use. So that minimizes the chance for contamination or any bacterial contamination. So then you spin it down, there's usually 2 spin downs that occur, and that takes maybe 20 minutes. And then you take your platelet-rich plasma and give the patient the injection. But on the average, the patient usually will see results within a few days. Sometimes they'll have worsening pain, for a few days actually, because there is an inflammatory process which leads to the healing. Okay, so it's important that the patient realizes that, and that actually you don't want to take things to block inflammation in this case. So you don't want to take Advil, Motrin, those kind of things, because that's going to block the action of the platelet-rich plasma. And you don't want to use cold or ice, because that also inhibits the inflammatory response that you want, at least for the first 48 hours. But there are other applications that I should mention, and some of those can be treating like other chronic pain issues, like chronic female issues like vaginitis that's chronic, can be very helpful. Can be helpful for treating facial issues, like if it's good for wrinkles, it's good for a filler. You can use it like a filler, a natural filler. Sometimes you can add some collagen with it, so it has, other definite uses that can be helpful.